Hi, I'm Dr. Sundaram, a online coach, couples therapist, trainer, mentor, and counselor from India. Well, friends, I'm going to talk to you about how I started my blog. What was the objective of my blog? mentorsundaramsblog.com. mentorsundaramsblog.com. Friends, I was asking my young couples who come for family therapy with me. I was asking them what are the basic questions they have before coming for counseling. And I remember one interview which of my had with my couples, young couples. That housewife was telling me three questions. One question was, what is the difference between psychologist and psychiatrist? She says, I don't know what is the difference between psychologist and psychiatrist. Second question was, what is the difference between counseling and psychotherapy? Whether I should go to a counselor or I should go to a psychotherapist. And the third point is, they were asking me, sir, how to identify a family therapist? How to identify a family therapist? These are the three questions, okay? Yeah. The difference between psychologist and psychiatrist, the difference between counseling and psychotherapy. This is counseling and psychotherapy, how to identify family therapist. Friends, the difference between psychologist and psychiatrist. A psychologist is a person who has qualified in psychology or mind science. Psychiatrist is mostly a person deals with the mind, but he has got a medical background. Psychiatrist is a person who is having a medical background. Psychologist is a person who is not having a medical background. Psychologist uses drugs and medicines, and psychologist doesn't use the drug and medicines. You can choose wherever you want to go. Then counseling and psychotherapy. Counseling is nothing but, it is a diagnosed talk. Please don't think lecturing is equal to counseling. Okay, if you go to a professional counselor, 80% of the time he will not talk. Are you getting the point? If a counselor is making you talk, and if he is a very good listener, he is a counselor. If he is giving a lecture, he is a lecturer, he is not a counselor. So, counselor is a person who has a diagnostic talk method, and the agenda is you, the client. Client agenda is the agenda, not his agenda. He will not tell, I did like this, I was successful, therefore you do it. He is not a counselor, he is a lecturer. Then psychotherapy is nothing but, psycho is mind, therapy is nothing but any treatment. It may be a diagnosis, then some interventions and some solution. He would diagnose, he would find an intervention, and he will use solution. Some psychotherapy, any psychological treatment is called. Well, how to identify a family therapist? Yes. This was a very touching question for me. I reflected for a long time. Very simple, you go to Google search, Google box, and psychologist in your city, or psychologist in Hyderabad, psychologist in Chennai, psychologist in India, a psychologist wherever you want to put it, you will get it. Okay, Google search, Googling. But I was not happy with the answer. In fact, that question which she asked me, and the subsequent story she told me, the difficulty is how she has gone from different doctors and different practitioners and her own story. And then I thought, okay, I should do something useful. That is one of the reasons why I started this blog, mentorsundaramsblog.com. The objective of this blog, I was asking myself why at all I should go to a blog. I go to a blog where there is some information. Therefore, I thought my blog, mentorsundaramsblog.com, will serve as an all India directory of all family therapists in India. Okay, it will serve as all India directory of all family therapists in India. So I went to every city and they identified one guideline I had was the video evidence. If there is an YouTube evidence of the doctor doing some work in that area, I have captured that YouTube and I have given the YouTube, and below I have written what is the work they are doing. I have given their website address, I have given their email address, I have given their phone numbers, I have also given the city name. So that any person goes through that, he can identify whether we have a family therapist in their city or not. First I am planning in India, then I will go globally. This is how I went about it. Maybe for the last 3 months I did, and you can see it in my blog. Friends, to tell you practically, I could find a handful of family therapists. They are not much in India. I talked to my co-practitioners, Dr. Malik from Lucknow, Raj, then I talked to Muttu from Chennai, Chennai Counselors Club, Psychologists Association, and they all agree there are very few of rather an exclusive family therapist in India. So I am coming to an end. My objective was to give you the details of the family therapist in India within video evidence. If there is no video blog, I am not able to give anything. So I have discovered that at the end I have discovered that there are about 3 types of practitioners. I'll show you. I have discovered there are 3 types of family therapists. One is an exclusive family therapist who is available online, he is available on Skype, he is available online, offline, okay, and dedicated only for family therapy. He does only family therapy or couples therapy or marriage therapy. This is an exclusively family therapist, I will call it. The second is a holistic in the sense, these people on totally they deal for anything, maybe a student counseling, maybe career counseling, maybe parenting, and everything they do. That is their area of forte. And third type of practitioners I am seeing is academic practitioners. Mostly it is personality development trainers and mostly academic psychologists, who are attached to some management psychological institutes. And they are also doing counseling. So they are doing counseling. So these 3 types of practitioners, family therapists I have come across. And my intention was that I thought this particular group is very big in India. Okay, but what I am finding is these 2 groups are very big in India. This is the very biggest group. That is focus on the teaching and also counseling. Okay. My intention was to focus on this. Now friends, I am coming to my end of my story. I want you to give me some ideas how to keep this blog alive. Many of you have written after seeing my blog how it was useful to you, how you are following it up. And I do not know how to run this blog. If you have something, please share it with me. Once again, I will summarize it. What actually I am looking for is your ideas. So that is mentorsundaramsblog.com. Okay, mentorsundaramsblog.com is still alive, the most service for you. Okay, I am waiting for your ideas, your questions, and I'll be very happy. Please go down, and whether you may be on YouTube or maybe in my blog or maybe wherever, you can reach me through different sources, email and through my blog, and I will be waiting for the ideas. Okay. Sorry, I am not able to. Wherever there is no evidence, I have made it very clear I am not able to include it. I want a practicing evidence. If you know some other doctors who are already doing it and they are either video evidence, please send it to me. I will also put it there. In fact, I went by every city Every city I searched a psychologist and I asked for an evidence. When there is no evidence, I am not able to put it. Once again, my request is, yes, please help me to give me some ideas so that we can work together, add more service through this blog. Okay, thanks a lot. Bye bye. See you next week. I'll be back with some other idea. Bye.